Dr. Sharp, thank you so much for joining us this afternoon. I have a couple questions. First, what are the goals of the ethics program at Mayo?
The Biomedical Ethics program here at Mayo Clinic has three primary activities. We do research to characterize what patients and physicians think about new technologies, with a focus on technologies related to genetics as well as regenerative medicine. We're interested in identifying some of the challenges that are likely to occur as physicians introduce these new technologies to their patients.
How has the field of bioethics changed, and what has led to those changes?
Well, bioethics as a field has its origins in the late 1960s and early 1970s. During that time, there was a great deal of concern being voiced about patients being disempowered in terms of their interactions with physicians and with clinical researchers. There were several well-publicized, well-known scandals that were documented during that same period. Probably the best known of which in America is the scandal involving the Tuskegee syphilis study. Bioethics as a field has always had as its primary orientation giving voice to those patients that are underempowered or somehow disadvantaged in terms of their relationships with physicians and with researchers. Its change has really reflected the changes that have taken place in medicine as new technologies have been developed and introduced into patient care. But its orientation and its mission has always had patients at its very heart and very center. So I think a lot of things have changed in terms of the issues that we take on, but our commitment to empowering patients remains just as strong as ever.
Genomics as a field is fairly new. How do you see it evolving over the next few decades?
Well, the costs of genomic sequencing have come down tremendously in the last 5 to 10 years. And with the declining costs, there have been a number of new opportunities to use genomic testing outside of traditional medical genetic settings. So whereas in the past we've used genetic testing to evaluate patients for very rare, uncommon diseases, with declining costs associated with genetic testing, we're going to be able to evaluate genetic factors that contribute to common complex diseases like diabetes and heart disease and so forth, that affect much larger numbers of Americans, but diseases where the genetic contributions to those diseases is smaller than in the context of traditional rare genetic diseases. So I think what we're going to see in the years ahead are genetic tests that give us some insights into the origins of those diseases, tests that predict a likelihood that we may have of developing one of those conditions over our lifetime, and that these are going to be administered much more routinely, much more commonly in larger numbers of patients.
I have actually a final question. With the increased use of mHealth mobile devices, people gathering their own information, do you see any risks for ethics or privacy?
That's a great question, and at this point I think it's difficult to predict the risk that might be associated with some of those technologies, but there are parallels to the risk that we associate today with genetic testing. The patterns of travel and the patterns of interactions that we have with others can provide really powerful biomarkers that identify us uniquely. The travel that I had today during my ordinary day is probably only associated with 3 or 4 other individuals. And if someone were tracking me, they would be able to identify that walking pattern as uniquely mine. And so as we look to the future and think about these applications and how they might be utilized in a variety of other ways, including, for example, in healthcare, we need to be mindful of the fact that they may provide unique biomarkers of our individual identities. And there could be some unique privacy risks associated with that.
Dr. Sharp, thank you very much.
Thank you.